I've got 5 top tips for you. My first top tip is number 1, consent. Always ensure you obtain full consent from your client before you start treating them. I would recommend that you have a sheet of paper which sets out all the risks and benefits as well as any potential side effects, so that you can ensure that your client has read and absorbed all that information before they consent to the treatment that they're going to be undergoing. Secondly, make sure that all of the side effects are fully explained and they are fully aware that those are potential side effects that could happen to them. If you have a nice sheet that they can take away and read with them, it means that you can prove that they have definitely taken on board all of the things that you've told them. You then need to make sure that they sign and date that form and you keep it safe. Often on consent forms there are other sections that you need to fill in, so we would suggest that you make sure that all of those sections have been filled in so there's no blanks. My second top tip is take good notes. Always make sure that you've recorded all of the treatment that you have provided on the date that you provided it. We would suggest that you make sure that any settings that you use on the machine is recorded, and also you keep within your notes photographs that you take before and after the treatment. You will need to take any notes that you take for 10 years after the treatment has been provided, so that you can ensure that you've got those in the future if a claim should arise. My third top tip is ensure that you are fully trained and your equipment is up to date. So you'll need to make sure that you can demonstrate that you've been undergoing training throughout your career and that you can provide certificates to prove that. You also need to make sure that your equipment is fully up to date and is in accordance with the manufacturer's guidelines. You'll need to provide the certificates for that, so please make sure you keep hold of those. My fourth top tip is patient selection. It's really, really important that you adequately assess whether or not your client has got realistic expectations as to what the outcome is going to be. So make sure that you explain to them alternative options as to treatment that they could undergo to receive the same outcome, and if it's not going to be a perfect result, make sure they really understand that. Finally, my fifth top tip is make sure you get a full medical history from the client and also explain full aftercare treatment and things that they need to carry out themselves. So for example, make sure that you have a list of all the questions that you want to ask your client in terms of their medical history, so you can fully consider what treatment you're providing to them as an individual. Secondly, if you're going to recommend that they stay out of the sun, make sure you record that in your notes, and also when they come back in, check that they have adhered to that instruction. If they haven't, or you notice that they have, for example, got sunburn somewhere, then don't go ahead and treat them anyway, because it will then be your problem and your fault.